SDP, but an active volunteer. And the reason for this is that I'm a member of Marwa, and Brema is here, and she knows that when the time comes, I will do what needs to be done. I also do not in any way represent any institution or organization that employs me. There are other public sector physicians who are much more involved in politics than me, for example, Janil Puducherry. And I have the same constraints as him, except that every time I travel overseas for a conference, I have to notify the MINDEF Notification Center. And the university seems to recognize my day job and has actually promoted me to full professor with tenure a few months ago without consent. So as Gerald pointed out, I think one of the key things is the philosophy of healthcare. And the SDP has always felt that healthcare is a basic human right. The human rights are not something that belong to Western countries, they belong to all of us. We are just as human as anybody else. And so human rights are there. The basic principles of the SDP healthcare plan are universal, affordable healthcare coverage to all Singaporeans. And we want to see a sustainable system which involves a medical audit. First of all, let me say once and for all that Singapore has very good healthcare. Okay, the healthcare is very good, we've got good doctors, we've got excellent hospitals. The problem is that it's not very affordable. And Singapore's very good healthcare has been there since the 1980s, at a time when the government owned all the hospitals, the government ran all the hospitals. And the government share of healthcare spending in the 1980s was close to 40%. When the government talks about going to 40%, they're talking about going back to where it was not too long ago. The current total health expenditure is about $12 billion. Government health expenditure is about $4 billion, and I'm sure Zillian is going to give you more statistics and figures. But the reality is that the 3M system accounts for only about 10% of total health expenditure. MediSave, about 800 million, MediFund, about 80 million, and MediShield, about 400 million. So where does the rest come from? As Gerald pointed out, most of it is actually out-of-pocket expenditure. And it's not just our out-of-pocket expenditure, it's out-of-pocket expenditure by businesses. Like I'm covered by the university. A lot of us are covered by our jobs. We go and see our panel doctor. Panel doctor refers you to a specialist, it's covered by your company. And the rate of healthcare inflation in Singapore is just ridiculously high. It's about twice the rate of inflation. So when we talk about healthcare reform, we're not just bleeding hearts who care about ourselves, but we also care about the economy. Because this high healthcare cost places a huge burden on employers, which makes it very difficult. The cost, you've heard this many times before, the cost of doing business in Singapore is very high. And a large contributor to this is this unbridled healthcare inflation, which is being triggered by the fact that so much of the healthcare cost is borne by employers. So what is the solution to this? Now the solution that the SDP has proposed is actually a new healthcare plan. And this is very simple. See, the current healthcare system is very complicated. MediSave, MediShield, MediFund, CMDP, CHAS, and there's so many different schemes. It's very, very confusing. But what we propose is a single-payer public insurance system. It's an insurance system, so it's not the same as the National Health Service in the UK. It's more close to the French or the Australian systems, which were rated by the World Health Organization as #1 and #2. There's also some co-payment, but there are caps on the co-payment. And we have done our sums. It can be afforded, and basically you do away with the 3Ms, you do away with CMDP, you do away with CHAS. Everybody who is earning a decent income pays $600 a year out of their MediSave. And this is actually less than what they're paying into their current MediSave contribution, so the balance gets refunded to them. But this is going into an insurance policy which provides for 90% of the subsidy for all acute hospitalization. If you are poor, you get a subsidized rate, or you get full subsidy if you're disabled or if you're unemployed. Children pay a prorated amount. So basically, it's $600 a year out of your CPF. You'll get a healthcare benefits card, and this card can be used at polyclinics and GP sittings. You know, Singapore is not really short of doctors. Everybody thinks we're short of doctors. But you go to every HDB block, there's a GP clinic. A lot of the GPs have got nothing to do. See, they're forced to do cosmetic procedures. Whereas if you go to a polyclinic, you know, you've heard this, a polyclinic referral to the renal unit in SGH, the waiting time is 1 year. You know, as the public sector is very stretched, the private sector is got too much capacity. So this card is going to break the barrier between the public and private sector because you can use it equally on either side. And we do recognize that there are some people who like to go to the GP and tell long stories because the GPs are such nice, friendly people. So we put a co-payment for non-urgent acute cases. So if you come to the GP and you spend a lot of time, then you will have to pay a certain fixed amount for the cost. But if you have an acute or chronic illness, nobody is going to choose to get diabetes or choose to get cancer. Then there should be a cap on how much you spend. And that is the sort of hallmark of the policy. So the key features are larger government contribution because the government has to pay for those who can't afford it. A public insurance system, regulation of the insurance system, co-payment with caps. So there's a maximum amount that you can pay, and responsive long-term care at the point of need. Basically, we feel that healthcare is a basic human right. See, we all feel we have the right to defense, we have the right to housing, we have the right to a safe and secure environment. We should also have the right to decent healthcare. Thank you.